Good evening, everybody. Very warm welcome to everyone joining this evening. We'll get started very shortly. I'll just introduce myself and Stacey. So I'm Alison Campbell. I'm the Chief Scientific Officer of Fertility. So I've been with the company 25 years this year. So I know all about embryology and the science. And I'm really pleased to introduce Stacey Hearn, who is a donation and surrogacy midwife. So she knows everything about donation. So hopefully you're in safe hands, and we'll come to your questions and answers later on in the event. So what you can expect this evening, about 40 minutes, maybe a little bit longer because Stacey likes to chat. 40 minutes of some presentation, some slides. We're going to talk you through the journey. We're going to talk about egg donation at care, starting with the perspective of the egg donor and then moving on to the perspective of the egg recipient. So after that presentation, we're going to start taking some questions, which please put in the Q&A section of the on the sidebar there, or else you can put them in the chat, the public chat function, whichever is easiest for you. So just introduce you to Stacey. If you'd like to say hello, and we'll get started.
Yeah, hi. As Alison just said, I'm Stacey. I joined Care nearly 2 years ago now. My main role is in the field of surrogacy. However, I am heavily involved in the donation side of things because lots of our patients will use donor gametes, whether that is they're using an egg as part of their treatment that's been donated, or whether that's sperm. And I get to see the donors coming through. I get to work with recipients. So yeah, hopefully I can give you a good perspective of that journey that you would go through as a donor or a recipient this evening.
Brilliant. I'm not sure who's driving the slides. I think it might be you.
You want me to?
Oh, no,
yep.
It's me. I'm driving. That's fine. So a good place to start always with a map. Let's get our bearings. And then my family will say when I'm out on holiday with them, I'm so boring because I just like to get my bearings. I want to see where everything is. But here we are, the map of the UK. And as you can see, we've got care fertility clinics all over the UK and also in Ireland, in Dublin. So the big circles are the main clinics where we've got laboratories, and then we have several satellite centres all around there. So plenty of a great network across the UK, and we work really cohesively. So when we're talking about egg donation, we recruit egg donors in all of those centres where we have laboratories where we can freeze the eggs or do the treatments, and also we treat recipients of the donor eggs in the same centres. So we move on to the next slide. And it's really important, we were talking about this earlier before we came on live, just what a very special gift donor eggs are. And our principle, our promise, and our philosophy is that family is for everyone at Care Fertility. And so egg donation plays a very important part in many of our patients' treatments, and it really is a life-changing gift. And Stacey, you have more first-hand experience of working with the donors, so you can probably explain a little bit more.
I suppose for us saying thank you as well, because the recipients will never be able to thank that person who has donated. We can only offer that thanks on their behalf because there is that anonymous aspect. So you wouldn't be disclosed as such. There are some changes in legislation that happened a few years ago. So children can find out in the future when they turn 18, they are allowed the information about a person who donated that egg at that particular time, but that wouldn't be disclosed until much, much later on. So for us to be able to say thank you, that's massive. And that is one of the things that when we do get those positive pregnancy tests, when we do get those photos that come through the email, or babies that are brought into clinic to say, this is my baby, this is the result of the donor who kindly donated their egg. It is really lovely. And yeah, it's one of those things. It's very hard to sort of explain it, isn't it, Alison? But it means so much to so many people with their treatment.
Yeah, that's right. It's a wonderful gift. And so the people who work in our donation department are wonderful people as well. And they spend a lot of time with both the donors and the recipients. And we've been doing egg donation for about 20 years. So we're the largest provider of donor eggs in the country. And so our lovely donation team, we've got Selena and Lisa here, who are based in Manchester, but we've got donation coordinators and nurses and midwives all across the group. So we have quite a specialist team. We have that expertise, the nurses and the administrators and the doctors who specialise in egg donation. So they have a very broad knowledge of fertility, but also a deeper understanding of everything that is associated with egg donation. And the treatments are tailored, are they not? Do you want to talk about that, Stacey? How we go through the process right from the beginning with the donors?
Yeah, so initially donors will get in touch with us. They will want to express their interest. I think it might be, some of this might be on the next slide, Alison. Am I right to flick through? So initially, when you make that inquiry, you will come through via the website. It may be that you call up and you speak to Gem, and they would direct you to our website where you can fill in a form. There are certain bits of criteria that we do need our donors to fit within, and that's not a care point of view, that's down to the HFEA. So that is our regulating body. They set these guidelines out, and it's all based on the evidence. So the age that we are looking at is over the age of 18, and you would need to be under the age of 36. So the reason and the rationale for this is to do with the quality of eggs. That quality of egg, as you age, naturally our bodies will change and things will not be what they were when we were younger. So there is that criteria to make sure that we are getting good quality eggs from the donor and making sure the donor's well, but then also we want those good quality eggs so that when the recipient comes to use those eggs, they're going to go forward and have that positive pregnancy and that baby. Now, it's not only just about your age. We do need you to be fit and healthy. One of the really important things that we really want to emphasize on is about that family history. There's about 40 to 50 questions that we do ask. It's quite an in-depth questionnaire, and we're looking at 2 generations of your family history. So we would be looking at your parents, so your mother and father, and then their parents, so your grandparents. And we're looking to see if there is anything that could be hereditary and passed on to any child born through your donation. Now, there are some things that can be identified that it's not going to affect someone's quality of life, that we would discuss with recipients and donors on an individual basis. But then there are some that we would actually say, unfortunately, there is too much of a risk for a child to be born with that particular condition. And we would discuss that on an individual basis with any donor coming through. And if anything is identified with a donor that we feel it's really important for a recipient to know, then we would give you that family history, because as your child grows and you go to doctor's appointments, it is important that you do find out about that. And then the other thing, what was the other thing there that was just at the bottom of that? Sorry, I'm going to flick back really quick. The BMI. So BMI is just literally linked to your safety when you're having an egg collection. And it's just to make sure that you're doing this out of the kindness of your heart. We don't want to be putting you at risk in any sense. So when that form comes through to us, we do go through them. We may come back to you and ask you some further questions. So it might be a little while before we say, yes, come on through, or it might be a little while before we give you that. Unfortunately, we couldn't accept you as a donor. So there can be that back and forth with us just to make sure we've got all of that information. The first initial thing that we want to do is we want to have that chat with you. We want to go through and know your understanding of what being a donor is about, because it's not something that happens very quick. It is something that it's a commitment and it is a journey, and we want to make sure that from the very start that you are committed. So this will be that we will talk through that timeline, how long it's going to take, the fact that you will need screening, the fact that you are going to have ultrasound scans. And these scans, they're not just one that you would normally see on TV with the abdomen. It is transvaginal, so it is a probe that is inserted into the vagina, and it can be a little bit intrusive, and some women can find that just an uncomfortable situation. Many of our patients who do come through and have them, they do find that they are actually okay. But it's about these things, making sure that you're fully informed, so that when you go, yes, I am going to do this, that you are committed. And I know there was a mention earlier about injections. There are an element of medications that are involved. So we need to know that you're going to be okay taking those injections, because that is how we stimulate the ovaries to get all of those follicles active and to get all of those eggs. So we need to know that commitment, and we would talk through all of that with you. The blood tests that we take, we are checking the normal things that you would check in terms of virology and sexually transmitted infections. But we also do need to check some genetic things. So these are things like cystic fibrosis, sickle cell, thalassemia. Now, you may not have these conditions, but you could be what's called a carrier. And what it is that two people would need to be carriers of a particular condition to have a child with that actual condition. So we do need to check those different conditions as well. So there are, and we will talk more in depth if you do come through as a donor. And for the recipients as well, we would let you know all of those bloods. I wouldn't quite brush over them that quickly. I would go in depth about every single blood test that we do, so you're fully informed about what that donor's had and what she's gone through. Okay, move on to that next one. So what is really, really important is the counselling element for all of our donors. It's a massive decision for you to decide to donate your eggs. It's very personal, and we don't always find out the reasons why people donate. If you want to talk about those reasons, that's great. But the most important thing is that you are fully informed, and you have that opportunity to talk with one of our counsellors who do this counselling on a very, very regular basis. What is important is you have that opportunity. Now, more recently, our counselling, it's not compulsory. It's something that you can decide that you're not going to necessarily go through that, but we want you to understand the implications of that, and the implications that what being a donor means to you, but also to the recipient. We also need to look at all the ethical implications of egg donation, and the fact I mentioned earlier about the law change, that any child born through donation has that right when they turn 18 to certain information. Now, that information is kept very private until that child turns 18, but on the 18th birthday of that child, that they could request that information. So being able to talk to the counsellor about that, we've had lots of donors, very different backgrounds, very different situations. We have donors that have had their families already and they know what it's like to be a parent and they want to donate. We've also had donors who are at university. We are based in quite a few cities where there's a lot of highly population with universities and lots of people going through education, and they want to start their families later in life. So in the meantime, they're going to go through, and it's important that they understand the implication of donating, because they may not be in a relationship at that point, and in the future explaining to their family this wonderful thing that they've done, and that at some point in their life when they have children, maybe even in 10 years time, that someone may eventually come to them maybe 10 years later when they've got children that are quite young. And it's about how that's explained through the whole family. And equally with our recipients, I know we're doing the journey sort of like we're starting with the donor and we're going into the recipients. We will be doing exactly the same with recipients in terms of counselling, but from the other point of view. So it's making sure that you are well informed about the different things that could arise, and we would talk about those different situations and how you would want to deal with those. It may be that you've got some questions that in your own mind, and again, everyone's different and everyone asks different questions, but we would give you that opportunity to talk about that. And the counselling's not limited to just one session. So we do have people that come back and have a couple of sessions with us. Some people feel that one session is more than enough. But what is important as well is with the counselling, we do discuss all the consents, and it is really, really important for the donor to understand those consents and understand what they are fully consenting for. And that can be down to how those the eggs and what will become the embryos are used, but also about storage, and even down to things like we do some teaching as part of care, and I'm sure Alison would talk about that with embryology, but it's about all of those different types of consents as well. So we do have to go through all of that with you too. So once you've gone ahead and you've had that, and you know, yes, I definitely do want to do this, I want to be a donor, you would meet with one of our consultants. So our consultants are there to look at your medical history, to make an active treatment plan. That treatment plan will be the medication that you would be taking throughout your stimulation, and it's making sure that that treatment is safe for you, and that also we're going to get a really good response from your ovaries to get lots of follicles and lots of eggs as part of that donation. So that can take sometimes a couple of weeks. It can be very, very quick, depending on your availability. And I suppose one thing I suppose that COVID's taught us is that we can do lots of appointments virtual. So we do a lot of our counselling virtual. We do a lot of our consultations virtual. There will be sometimes that you will need to attend clinic. So we'd have to do a scan in a face-to-face capacity. Your blood test we'd have to do in a face-to-face capacity as well. And then any scans during that stimulation and the egg collection would be at that particular clinic. But otherwise, we can do lots of telephone calls. We can do virtual face-to-face in a video. So there's lots of different ways that we can do that. So when it comes to the point where we are ready to start stimulating and we are ready to start moving forward for collecting the eggs, that is where you will get a protocol. A protocol is a little summary of how you're going to take your medication. So it will tell you step by step on how to do that based on the treatment the doctor has decided. So this lady on screen now, this is Diane. She is on our YouTube, where she does all of our injection teachers. So we would be able to put you on to that website, and you would be able to have a little look at those videos. And what is amazing about these videos is they're available 24/7. And because of some of the times that you'd be taking your medication, it could be, oh gosh, I totally forgot what the nurse said to me, I can't remember. You can be directed to this website at any point, and her videos are very, very easily understandable. You'd be able to have that help there. So we would also do the monitoring scans. At a minimum, I would say you could have up to about 2. Sometimes you might have a few extra if you need a few extra days to carry on to get those follicles developing. And based on those scans would be when the decision is made as to when your egg collection would be happening. So with the egg collection, it is a day. You would need to come into that designated clinic, and we would recommend that you do have someone with you for company. There is an element of sedation. So what that can do, oh, lovely, screen changing for me. So with the sedation, all that means is that you might not be able to drive, you might be very drowsy. So having that person with you will definitely help ease that recovery for you. And you want to be comfortable and not having to then drive home from a clinic. The procedure itself takes about 20 minutes. It's very, very quick. You will go in, the eggs are collected, and then afterwards, what is really nice is someone will be able to come and tell you exactly how many eggs have been collected. And Alison, that does happen, doesn't it? You look at those eggs in the lab and then come out and tell the donors exactly how that's happened. So at that point, you would be going home to rest. We do follow up on you afterwards because we want to make sure you're okay. So we will make sure that you are okay following that donation.
Right.
So if you are looking at donating, then you can obviously contact through the website what we will do throughout the whole process of you being a donor is support you, whether that is, as alluded to about the counselling. You can get in touch with us anytime for that. We have got a forum that is accessible 24/7, and we've got a real active community on our social media. So we are on Instagram and Facebook. And within the clinics as well, every single clinic that you saw earlier on the map that Alison showed, there is a donation team. So there is always someone that you are able to talk to. And it doesn't even have to be someone from the donation team as well. We've got a massive team of nurses at all the clinics, and everyone is there to support all the patients through their journey.
Great. I've just seen a couple of questions come in, so I think we'll just answer one as we go along, and then we can, because it's topical. What happens in the lab when my eggs are collected? So if you imagine I'm an embryologist and I'll be in the lab, I'll be looking down a microscope. So the follicles that Stacey's been describing that are developing on the ovaries will be aspirated. So the egg will be sucked out with a very fine needle into a little tube, and then one of my colleagues will be in the laboratory looking down the microscope to find them and take them from this fluid and put them into a culture dish, a little petri dish, where we'll keep them in the incubator. So that's why. And often, because it's a mild sedation, it's a conscious sedation, the donors can hear the laboratory team explaining how many eggs they've got, and as in a live setting, as we find them, as we collect them. So a lot of them quite enjoy that, because it's just to know they've been cultivating these eggs for a few weeks, and we've actually got them safely in the incubator. So we'll move on.
There was one about counselling just there, about further counselling down the line if you want it. Counselling's available anytime that you wanted it. If you needed it, you can contact the clinic. You can contact via Gem. Via the social media pages, we can easily get that organised. That's not a problem at all. So there was another question about looking at the donor for certain characteristics. So this is more from a recipient point of view. When you come to looking for a donor, you enter into the egg bank. Now, on the egg bank, there are certain characteristics. You can see the height, the weight, and the BMI of a patient. You can see their hair colour, eye colour. You can look at someone's ethnicity. You can see someone's skin tone as well. And then the other thing is whether they have proven fertility or not. So proven fertility means if they've had their own children. What that doesn't show you is if they've actually been a donor and been a successful donor. And obviously I can't disclose different things about donors, but the results that we have with our donors that have not got that proven fertility, that yes or no, we have donors that have donated and created so many families, but they don't have children themselves. So I wouldn't ever be put off by that. And I speak to loads of our patients regarding that, but they are the few different characteristics you can look at. With the characteristics, what I will add is sometimes a patient will want those characteristics to mimic their partner. So we totally understand that as well. However, there are some characteristics that it might mean that you might wait a little bit longer because those characteristics could be in demand. There are certain I can't even say the word, ethnicities that you may be waiting that little bit longer for, and we would explain that to you when we came through. We did have a spout as well where everyone wanted blonde hair, blue eyes. So those donors were very hard to come by too. So it just depends on what you are looking for. But there is absolutely loads of choice. I was in the egg bank earlier and there's over 100 set of eggs, and there is no wait for the egg bank either. You can get automatic access and you can look at every single donor in there.
And just to finish up the perspective of the egg donor then, Stacey, so they can find out some information about the outcomes of their egg donations, can't
Yeah, they can. So when you're a donor, you can call the clinic and ask us to run a report, and that report is basically giving us the information on your donation. So the information that we are given is the information that we would then give you. So you can find out if your donation has been successful in terms of what year, whether it was a boy or girl, and you can also find out that there has been what's called a live birth, and that's just what the system refers to any successful pregnancy. Now, the other thing is that if you are a recipient, you may want to find out if your donor has had further successful donations with those eggs that you've used with your child. So once you've had a child born through donation, you can also inquire to find out if there are any genetic links from the same donor. So it might be that someone else was having treatment at the same time as you, and you both fell pregnant around about the same month. And when you inquire that maybe there was another child born the same year of the opposite sex or the same sex, so you know then when your child is growing up that somewhere out there is that genetic link somewhere.
Great. So let's move on then to IVF with donor eggs. So this is now we're coming from the egg recipient's perspective, and just to talk through a little bit about the process from their side. So a bit of background, I'll do this one, just to say about the main benefits of coming to treatment at Care Fertility when you're needing egg donation. Because Stacey's described, we do have quite an extensive egg bank and a lot of experience in egg donation. So we are one of the leading egg banks in Europe. So we've got lots of donors to choose from. And we could next time maybe put a screenshot of our egg bank, because it's nice to online, you can look and choose based on the physical characteristics what suits you. And so we try and personalize this to allow egg recipients to choose which donor meets their requirements, and often that is the physical characteristics, but it depends each individual choice. So there are lots of options and lots of donors available, and really transparent pricing structure. So there are various offerings, and we won't go through them in any detail because that's a personal thing, and it's nice to be able to see there are different options depending on requirements. So all of these donations and all of the treatments are taking place in the UK. And we do know that there's a growing overseas tourism for fertility going on for lots of reasons, but I think you can be reassured, we absolutely can be reassured that the donors that we have are all recruited and screened in the UK in our clinics. So we have full control over the quality of the egg donors and the eggs, and also the processes in our laboratories we use to freeze those eggs and also to thaw them. And we do get consistently high results, so we might talk about that a little bit later on. So fresh versus frozen, and we've talked mostly, I'd say, about the frozen egg bank, because that's, we're really proud of that. We've been running that for a couple of years now, and it's been very popular, and it gives recipients a lot more choice and flexibility because they can see all of these eggs that we actually have stored in our frozen egg bank. But we also do offer fresh egg donation as well. It takes a little bit longer, it's a little bit more complex because we need to try and synchronize cycles so that the recipient's ready when the eggs are ready, when the donor's ready. So a little bit more complicated, but still very successful. And it was the way we used to do all of our donations before we started the egg bank with the frozen eggs. Do you want to say anything about fresh versus frozen, Stacey?
No, I suppose it depends on the recipient's choice as well. A lot of our patients that are going for the frozen also do it for the fact there are so many different donors that they can choose from, whereas with the fresh, you are limited to those donors that are coming through at that particular time. And when I refer back to that map that we looked at the beginning, a frozen set of eggs could come from anywhere across the care group. With fresh, you can only be matched to someone that's within that particular area. So it could be that a donor's coming through 200 miles away who is perfect for you, but because they are donating in a different clinic, you would only be able to have those eggs frozen. You wouldn't be able to have them fresh. So the benefit of the frozen is you do have a larger pot of donors to be able to choose from, especially with those characteristics we were talking about. But then some people do prefer the fresh because they want to know that everything is synchronized and they're fertilizing those eggs as soon as they've been collected. It is just a personal preference there, isn't it, Alison?
Yeah, so, and we go through it with, nobody's rushed into making any decisions. We go through the pros and cons and the availability, and make a choice so the patients can make a choice that suits them. So the vitrification, a bit of a science lesson, we won't go into too much detail, but we use a process called vitrification to freeze the eggs, and it allows them to be taken down to minus 196 degrees, so really, really cold in liquid nitrogen tanks. So it's a very precise procedure, and our embryologists are highly skilled. It is one of the most challenging procedures that we do in our laboratories, I would say, but it's highly successful. So this is why egg banks are becoming more and more popular, because the process has been mastered. So around 85% of mature eggs that we vitrify, that we freeze and store, will survive that freeze-thaw process. That's a really quite a high survival rate. And once we've frozen and thawed them, they behave very much like they were fresh. We don't see any compromise in fertilization rates or embryo development rates or pregnancy rates. So it's an amazing technique, which really has made a really positive difference to our egg recipients. So IVF using frozen donor eggs. So we've covered this already, really, I would say, but just to go a little bit more technical. So once we collect the eggs from the follicles, we described that in the laboratory, then we need to prepare them for the freezing. So we remove all the nursing cells that are around them, the cumulus. They look like little clouds when we first collect them. Then we do the freezing process, and then when a recipient's chosen them and we've thawed them out and prepared the sperm for the insemination, we add the sperm to the eggs using a technique called ICSI. And here's a beautiful video of an ICSI procedure. So the sperm is in the tiny pipette now being pushed into the egg. We aspirate, so we suck a little bit back to make sure we've broken this very elastic membrane of the egg, and then gently place the sperm into the egg. So a bit of magic. And that is then the eggs are left overnight, and fertilization then hopefully takes place. And around 70 to 80% of eggs that we undertake ICSI will go on to fertilize. So that's great. And then we culture them for about 5 days further. And this is an embryo developing, which we've monitored using time-lapse imaging. So you can see the cell number increasing. And on around the 5th day, like here, we see a cavity forming inside the embryo. And this is called a blastocyst. It's a very special stage just prior to implantation. And now the blastocyst is starting to hatch through the shell. So we can transfer embryos at this stage, either at the blastocyst stage, or if they're hatching like this, that's fine. And we use special algorithms called care maps to assess which embryos are the best, which one is going to give the best chance of a baby. Very sophisticated algorithms and models based on the timing of the embryo's development. So we've built this in-house based on thousands of embryo transfers where we've got this important data. So we are actually leading the way with embryo selection as well when we talk about time-lapse imaging. So we've transferred, yeah, so once we get the blastocyst at that advanced stage that we've just seen, then we can perform the embryo transfer. And that is similar to a smear test. We use a speculum and a fine catheter just to go through into the uterus, and we deposit the embryo. And that's a beautiful picture of another egg there. So this is again to talk about the benefits and differences between frozen egg donation and fresh egg donation. So the frozen egg donation, we've talked about the flexibility, the choice is greater, and potentially more less stress and less anxiety, more flexibility than with the fresh eggs, because we know we've got the eggs, they're in the bank, we can thaw them and proceed accordingly. Whereas with the fresh donation, we have to synchronize. So sometimes we get disappointments if things aren't going to plan with the donor. So there we have it's a nice picture of a romantic looking sperm. So do you want to say anything else about the fresh donation?
No, it's just, I suppose the only thing with the fresh donation that we would go through with you, if that's what you were deciding to do, is we do have to make sure that you are working alongside one another. And sometimes there can be times where we do have to cancel the cycle if maybe the donor's not responding, or it could be that the recipient, the lining's not getting to the point that we need it to be able to do an embryo transfer. So although you might have created those embryos with the view to one going in fresh, the recommendation may be from the team and the doctor that the embryos are actually frozen. So, but again, these are the things that we would discuss with you.
Yeah, and another difference here with fresh donation, because we don't need to remove this cloud of nursing cells before the freeze, we can do a different technique to fertilize them. So we can use a conventional IVF where we mix the eggs with the sperm rather than inject the sperm into the egg. So equally successful, but it's the original method of fertilization, in vitro fertilization, IVF. So we can do that providing the sperm quality, the numbers and the motility of the sperm are suitable. Otherwise, we can just inject a single sperm into the egg. So if we've got low numbers, or they're not swimming so well, or there's any risk of failed fertilization with IVF that we're concerned about, then we will just go straight to ICSI and inject a sperm into each egg. This just to briefly mention CarePay, it's a refund program which is available. We won't go into great details because what we do at consultation is talk about the different treatment options available. So this is just one of them, whereby it includes up to 2 treatment cycles with donor eggs over a 3-year period and unlimited frozen embryo transfers. And there's a partial refund if it's not successful. So it's a great product, but we've got several others that we would go through with you, and you can choose which suits you best. So it's time to move on to the Q&A section. Just do 10 minutes or so with questions and answers. So we've got a few coming in now, and we've also had some sent previously. You covered the one about the needles. I think we talked about the needles are very fine for their medication, so we probably don't need to do that. And also we've got those videos available for teaching and supporting the donors when they're having their injections. Why do we have to have ICSI with frozen eggs? Well, this is all because of the way we process the eggs in order to freeze them. So we have to remove these nursing cells, and they're important with a conventional IVF to help activate the sperm to fertilize themselves in a culture dish. So once we've removed these nursing cells and undergone a freeze-thaw process, they won't be able to be fertilized with IVF. If we put them in a washed suspension of sperm, we don't get fertilization because of the processing that we've had to do. So that's why we overcome that by injecting the sperm into the egg, and that's the ICSI. So there are some more questions here. Have you seen any that take your fancy, Stacey?
I'm scrolling through now. I know some of the answers have been done. There is one about when a child turns 18, about them being able to access who they are. Now, one of the things we do say, it is important that our donors do keep all their contact details up to date. We do pre-warn recips that not all donors will want to be contacted. There is obviously that option that they can be contacted, but it is something that we can't withhold those details from that child. They have that right to know when they are 18. It can put some people off from donating. Unfortunately, with it being the law change, it's one of those things that in the UK now, all donation, there has to be that trail for us to be able to let that child know. I suppose it is one of the things, it's a personal thing that you would have to think about whether or not you did want to donate. I suppose as well, depending on how many eggs you have in a collection as well, it might be that those eggs are only enough for one person to have treatment as well. So there was also a question a bit further on about how many times someone could donate.
Yeah.
One of the things the HFEA want us to do is to keep a number of how many families are created. So we've got a 10 family limit for anyone who is a donor, whether that be egg or sperm in the UK. And 10 families, that would just mean 10 individual families of recipient, but there could be multiple children within those families. It could be that one family has a set of twins, another family may have 3 children from that donor. But we do have to keep an eye on that as well. So if when you are donating, you're getting very large numbers of eggs, we might say to you, we'd not have you donate again just until we make sure we've not gone anywhere over that 10 family limit. We want to make sure you remain within that. And we are very strict with that, aren't we, Alison? We do check those numbers on a very regular basis to make sure they're within that.
Yeah. And with egg donation, it's not particularly common for us to be reaching those sorts of numbers. I mean, the average number of eggs that we collect from a donor is about 12. And so some of them won't be mature or won't survive the freeze thaw, and some won't fertilize. So it depends, but we don't generally get to 10 families very easily with egg donation, I would say. And donors can come back there multiple times to donate. So what is there a limit on the number of times they could donate?
Yeah.
Because we do have some that really want to keep going.
So from a safety point of view from the donor, and obviously being a donor is not going to affect your fertility itself. It's so that's another question that we do get: will being a donor affect my fertility and my chances of being a parent later? It's not going to. However, it is an invasive procedure. It is that fine needle that Alison alluded to earlier that is passed up and through, and we are aspirating those ovaries to get them out. So we do say 6 is the ideal number that we wouldn't want to go someone through. And exactly what Alison said, you'd have to have got a large number of eggs each time you donate to reach that 10 family limit. And it is hard for a woman to reach that 10 family limit. We have had some, but they're rare. They are rare.
And what would you say, Stacey, is the typical number of donations that a woman might make?
Some women come through and they only want to do it the once. And for them, they've done their donation. They're really happy they've done that and they're able to help. Some people can be laid in the recovery bay afterwards, and you go and speak to them and they're like, can I donate again on my next cycle? And some women just want to go again and again and again. I suppose it's a very, very personal choice. If someone's not enjoyed the injecting side of things, they might not want to do it again. It might be that they've gone through it and they've not felt any side effects from anything, because obviously we are talking about medication that could have some side effects, maybe a little bit of nausea. Some women can feel a little bit heavy around where the ovaries are at the front near egg collection. And some people decide that actually they've done it that once, they're happy, they're not going to do it again. But then other people are like, sign me up again. So yeah, it's personal choice there.
Yeah. And do donors find out about their own fertility when they're donating? Because we're doing all these tests and health checks.
Yeah.
So I guess that's quite informative for them as well.
Yeah, it is, because one of the things that we do have to do is we have to take a blood test called an AMH, which shows us the ovarian reserve via that blood test, and then we pair that up with a scan where we count the actual follicles, and from that we will have a good idea of that lady's fertility. So we are able to, not only are they going through to donate, but they are talking about that. There is something that has just come up quick about the 10 family limit. What I will say is all of our donors are allowed to choose their family limit. Some say 10, some donors will come through and they might only want to donate for 2 families. That is the donor's choice. So if me saying 10 family limits has put anyone off, please don't be put off, because you could turn around and say, actually, no, I only want to donate for 2 families. And that is your choice. It is your consent, and we will do whatever you are consenting for.
Great. Oh, that's great. I think we're probably coming to the end of the session now, but we'd be happy to have all your questions sent in. We've got it through email, or you can ring our clinics and we'll answer questions. And any that we've not covered that might be creeping in, we'll get back to you by email or through the chat function. But it's been an absolute pleasure. Stacey with a Christmas jumper. Thanks, Mike. So cold. So everybody have a wonderful evening and keep warm. And I hope you found this informative, but please do remember that we are here in all of our clinics waiting for your questions, and very happy to support you. If you want to be a donor, or if you need donor eggs, we can help. Thanks, Stacey.
Thank you.
Bye, everybody. Thanks.
Bye.